Hi everyone. Thank you for joining us again this evening on Cam. I'm Nicki, and this evening we have Emily Ashdown joining us. We're going to talk about something that we haven't really done very much on Cam, which is stance analysis, and it's becoming quite a big thing, and it's a really useful tool. So we're going to have a little look into that. And Emily, I'm going to get Emily to introduce herself and just tell us a little bit about what she does shortly. But I just want to bring everyone's attention to the fact that our big walk in September is now finished because it's October. And I'm just going to pop this up here because we want to say a big thank you again to the sponsors for the big walk who keep Cam going. I mean, without their sponsorship, we would have really struggled. So thank you so much for everyone that took part. There are still little walks going on. So if you do want any more information, please do jump online, go on the CAM Facebook page, get some more information. And just, all these companies that sponsored us, they all play a part in helping dogs with arthritis. And again, just want to say thank you for their support. And there probably will be another one next year. So do watch out and please do carry on supporting Cam if you can. So, Emily, thank you so much for coming on to Cam. Would you like to just give us a little introduction about what you do nowadays, because you've had and how you came to this point? That would be a useful thing.
Yeah, of course. So thank you guys for kind of having me on, first of all. A little bit about my background. So I'm a vet nurse and vet physio. Been working in the veterinary industry for about 12 years now in sort of various practices, establishments, charity hospitals, that sort of thing. And about 8 years ago, I became interested in rehab. Our practice bought our first laser. So that kind of piqued my interest as we started doing kind of laser clinics, and really found a passion for rehabilitation. And I got to know companion animal health really, really well, and moved over to kind of work for them as a product specialist, whilst I also worked in rehabilitation centre. Worked kind of with them for a few years as their kind of UK product specialist, kind of all over the UK, just kind of teaching how laser therapy, stance analysis and regenerative therapies worked, and kind of helping practices and physios, rehab setups to put those tools into practice. And then COVID, I had a little girl, so I took a little bit of a break, and then kind of coming out of that, back to companion and kind of moved into product management role. So I now manage the stance analyzer and regenerative therapies globally for companion animal health. So that's pretty much in a whirlwind where I am.
Yeah, I mean, it's quite a big thing. If it's global, it's yeah, massive, really. So you're actually still working at the moment, because you were saying you kind of work on US times, don't you? So you're still kind of in a work day. So thank you for giving up your time for us.
No, that's absolutely fine. It's like I say, it's kind of the middle of my day now, so
Yeah,
I've got to do it quickly.
lunchtime-ish for you. As always, as we're going through, please do jot down any questions in the comments section. Emily's very happy to answer anything, and I'll pull up anything that I think is relevant at the time. So please do ask your questions or share your thoughts or whatever. No question is ever stupid. So let's crack on. We're going to talk mainly about stance analysis, but I think the whole sort of rehab is going to come into it a little bit, because the whole point of stance analysis is to help our arthritic pets, and rehab is going to change depending on what we find on these things. So let's start about why stance analysis is important, and where do you see it playing a part?
Yeah, so there's kind of two main goals for me of the stance where it's really, really useful, and that's both in the rehab facility and in our kind of general practice vets. The first kind of main thing is helping us to identify changes earlier. We all know how difficult it is to kind of really spot those very subtle early signs. And they actually say that the first 20% of lameness is invisible for us to detect via the naked eye. And that's because dogs are amazing. They've got 4 limbs. They can very easily kind of shift that weight over without you really noticing.
Yeah.
So that first stage of arthritis might be occurring before we've even noticed anything going on. So the first stage for me is the use of the stance to just do like a general checkup. Any dog that's over the age of 8, in particular, when they're coming in for, say, a vaccine checkup, just having a stance reading and just checking, is anything starting to change? Is there anything that we need to monitor or keep an eye on, or even actually start looking at diagnostics and a workup to get in there as quickly as possible? Because we all know the earlier we start treatment, the better, the slower the response. And actually, interestingly, my own Cocker Spaniel, Vinny, who many of you that will have heard me speak about before, I always talk about Vinny. When I first started using the stance, I was using him as my test dummy, and it kept coming up as left hind lame. And I was like,
oh, really?
no.
He's not.
And he was like 2. So it was that kind of classical, just you start to see things going on, kind of, and become a bit more convinced there is something. So I was like, okay, it is consistently coming up. So we had him x-rayed and kind of went from there. And it turned out he ended up with a whole myriad of problems, joint problems, but he was so well covering because of how much he was shifting and those subtle changes, that he'd hidden it so well from us. So that's my own personal experience from early stage. So that would be the first main use. The second for me, and I would say probably the most important from a therapist point of view, because there's very little that we have that can really tell us, yeah, what we're doing is absolutely right and we're going in the right direction. And it's using it as a treatment monitoring tool. And again, it could be in the general practice. It doesn't have to be in rehab, because it could be that the vet's done surgery. It could be that we've put them on a new medication or even a new supplement, or it could be anything that you've done or the vet's done or therapist has done that should be having an impact on how comfortable that dog is and how comfortable they then are to put weight through. So we can use it then as a monitoring tool to say, yeah, that treatment, that's doing its job. We're going in the right direction. Or even the other direction, which I think we often maybe don't think of, is actually, are we doing well? Actually, do we need to change that dose? Do we need to increase kind of how frequently we're having laser, or how often they're coming swimming? Like, it's being able to say, yes, we're doing well, or actually, we're not doing so well. And there's not many things out there that help tell us that.
No, and so objectively as well, because it's figures, isn't it? It's telling you exactly. It's not like, it's not a grey area. It is yes or no. This is exactly what's happening. I was just thinking, as you were saying that, I would love to see what happened in an arthritic dog as it lost weight. An overweight arthritic dog. That would be amazing. As it lost a kilo, how is it using its really bad leg or legs? And that would just be really not. I mean, I was going to say interesting more than useful, but actually it would be useful, because then maybe we can bring down some of the medications, because the weight is kind of a treatment. Really.
And as
really
a side, it does actually take weight as well, so you can monitor that at the same time. But absolutely, and it literally is anything that you do to that dog that is changing how comfortable they should be. We can use it to monitor. It doesn't matter if it's weight loss. It doesn't matter if it's a new supplement you've added in, or could even be, okay, well, we've changed, we've put rugs down in the house, so they've not been slipping as much. How much has that improved things as well?
Yeah. And I think with early detection, sometimes people would come in and say, maybe as a 2-year-old dog, oh no, we definitely don't need that, and there's definitely no problem. And it's almost like the wanting to find something when there might not be something. But if it's a very slight change, something very tiny, it might not even be that you're going to have to go ahead or think about doing x-rays or start medication. It may just be like, we've got this now on our radar. I'm going to stop throwing the ball quite so much, or I'm going to lift my dog into the car or get a ramp or something. It's not like the end of the world. It's just something to give you a little signal. Well, we should check this again in 6 months and see what's happening.
Exactly. I mean, it doesn't mean just because, okay, we have a 1 or 2% drop on that back left leg, that doesn't mean we need to race in there right now and put them under for x-rays and start a workup, we can say, okay, well, we've got this starting point. Let's see what happens over the next few weeks, the next few months, the next year, and kind of see if that change occurs. It's just like if we were to take a blood sample in a younger dog, you've got that baseline of figures then of what their kidney parameters are doing, what their liver parameters are doing.
Yeah.
And it's then, if ever you take future blood samples, you've got that baseline to refer back to. It's exactly the same principle with this. You've always got that baseline to say, okay, we started at this, we're now at this. That's the difference.
Which is something actually you don't often have with other diagnostics. Because I know sometimes when I do x-rays of dogs' hips or elbows, I think, oh, I'd love to have seen this when it was 1 or 2 and just see if there's any difference. But because it's a lot more difficult to do that kind of thing, you need an anaesthetic. And this is just fantastic because it is just something you kind of, well, we're going to go through how you use it and talk a little bit more. But yeah, a lot simpler to use and yeah, giving you lots of information.
A bit more friendly to the more nervous patient, shall we say.
Yeah, exactly. Because that's the other thing. Well, I don't know, where do you want to go from here? Do you want to talk about actually what it is and how it's used so that people have an idea of what we're talking about? Because people may not have even clocked what a stance analyzer is. So let's maybe talk about what it is and how it works.
So let me pull up, if we pull up presentation, just on the slide, I'm hoping.
So what is it? There we go.
Can you see what it is?
Yep, I can see the pictures there. So basically, a lovely big soft bed. Mat.
Yeah, it's so it's a weight distribution platform. So basically, you've got 4 very sensitive pressure scales underneath that platform, and what they're looking to do is when you pop the dog on, so you want 1 paw in each quadrant, and then it's connected up to a laptop that's got specialized software in. And then you have a remote. So when your patient's or your pet's in position, you'll take a capture with your remote, and that will instantly take 25 captures. So in sort of a nanosecond, it's going to take 25 screenshots of how much weight is going through each of those quadrants. So the machine knows that there's a total weight. So let's say 30 kilos, your dog's 30 kilos, and it knows that 30 kilos, there's pressure going through each quadrant, and it's going to divide based on the pressure and put that kind of weight into a percentage. So in a perfect dog, we would have 30% in each forelimb, so 60% of the weight in the forelimbs, and then 20% in each hind limb, so 40% total on the hind limbs. So what it's then going to do is give you an averaged out figure based on those 25 captures. So on this kind of right hand side, you've got your in the top corner, you've got that average figure, and that's going to be your end result. So if we're looking at this dog's readings where it's color coded on the graph, you can see he's got 30% going through his left fore, 31% going through his right fore. So there's 1% increase on that right fore, which is just as important as the lameness, but we'll come on to that. And then you can see there's 19% going through that left hind. So that's a 1% drop in weight bearing. And then that right hind is 20%. So that's normal. But obviously, as that pet is bearing less weight through a limb, that percentage would drop, and that color coding also drops. So it makes it easy to understand. So if it was 1% drop, it'd be yellow. If it was a 2% drop, it'd be orange. And if it was a 3% or more drop, then it would color code it red, because we really have a problem there.
Right.
So it just gives you a good visual. Okay, this is what I should be, 30, 30, 20, 20. But actually my dog is weight bearing 30, 31, 19, 20. Now that's not a bad result.
No.
But obviously in every dog is different. For example, my Cocker Spaniel, when he was first diagnosed on his left hip, I think he was about 12%.
Really?
Yeah, and like post-surgical. Yeah, I've seen some post-surgical, so post-TPLO, cruciate surgeries, 2 days later after the surgery are only weight-bearing 3%.
Wow.
So it really helps give that visual to actually what's going on, how much weight really is going through that leg.
Yeah. And I think when you say that it has like 25 captures, you think initially, my initial thought was, well, the dog's never going to stand still enough for that. But actually, you just said it's like in a nanosecond that they have all that, that information. So even
Yeah.
if they move, it almost doesn't matter. I mean, how many times would you do it?
So if the dog is in good position, you only need to do it the once, as long as you're
Okay.
happy with the patient's positioning. I will say, so we did a recent update on the stance analyzer, and previous versions of a stance used to have to keep clicking to take individual
Right.
captures. You used to have to take like 15,
Yeah.
but it's this recent update that we've done that kind of takes the 25 instantly for you. And from a user point of view, it's kind of much easier because it is that nanosecond that you've got to keep that dog's attention versus the wait while you're kind of clicking. So much more user friendly and easier. And like I say, as long as that dog's position is kind of accurate. And when I say accurate, we're not looking for a perfect stance. We're looking for what's normal for them.
Yeah.
So if your dog stands a little bit wonky, then that's what we want them to look like when they're on the stance. We don't want them perfectly squared up unless that's what they stand like. So you've just got
Because you
to be
can see in
happy.
that picture, he's not kind of right in the middle, is he? He's got slightly back, but as long as each foot is on different quadrants, it doesn't matter where in that quadrant, as long
That's
as
it.
it's on there. And
Yeah.
is there a weight limit? You have to be a certain weight for it to work, or?
So from the upper limit, they need to be under 120 kilos. And I would
Which
really
most
hope
dogs
that there
are.
isn't a dog out there that big. I think the maximum I've had on was 95 kilos, I think it was.
Wow.
He
Okay.
was huge, but we still got him on. But from the lower end, it's 5 kilos. Because
Okay.
the problem with kind of like anything under 5 kilos is just there's not enough pressure going through to be as accurate. You can still take a reading on a smaller dog, but the problem is it's just how accurate that data is based on how much pressure is going through. So it has improved dramatically over the years, the sensitivity, and you can still, like I say, take the reading, but we just don't have as much data to kind of support the reliability and the accuracy in those smaller weights.
Yeah. And did you want to touch on a little bit? Well, hang on, let me just answer this question from Barbara here. Barbara's asking, is there a difference with head position up and down?
Yeah, so we do a lot of training whenever we obviously install in a clinic, whether it's rehab, vet, wherever. We do a lot of kind of training with the user because kind of how they're positioned is really important, because it needs to be as natural and as neutral as possible with kind of very little influence from the environment. So we talk a lot about kind of making sure we're in a quieter room, less distractions, using treats and kind of Premier cheese to distract the front end. But what we're aiming for, again, it depends on what their normal stance is. So if you've got a dog that may have cervical spine or fall limb issues, that means that actually they can only hold their head in a certain position, then we'd want to reflect that. But in most healthy, normal dogs, we'd be looking for a neutral position. So a lot of handlers sit down directly in front of them rather than stand up, so that you're at their level. And that way the dog's looking directly at you as opposed to looking up or looking down. So we're trying to get that neutral head position.
Yeah, that makes sense. And because I think if you offer them, the temptation to get a dog, especially a foodie one, is to tempt them with a bit of food, isn't it? But then they're going to lean forwards or lean back to put their head up to get it. So it's just getting them
You've got
in
to
position.
pick and choose.
Yeah. And then is there a lot of work done to show how reliable these are, and other papers that maybe we could put links to about more information?
Yeah, absolutely. So there's been lots of studies done looking at the accurability of the stance, but also the stance has been used in many, many papers as a validation tool to objectively measure outcomes for other things as well. So it's not just a case of it being used to validate its own measurements. So the biggest paper, I guess, to validate the stance platform was a comparison that looked at the data from the stance versus a gait analysis walkway. And what they looked at was the peak vertical force of the dogs on obviously the walkway versus the percentage given of them kind of standing still on the pressure sensitive platform. And what they actually found was actually the platform, so our stance, was slightly more accurate than what the gait analysis walkway was. And that's because you don't have the movement element, because obviously as soon as you add movement in, it's very difficult to get full pressure through each limb. So that kind of really was great because it backed up that absolutely the stance is just as reliable from a data perspective as gait platforms. And then, like I say, we've gone on to do so many studies. There's some really cool data looking at the effects of a TPLO in a dog that's had its other back leg amputated.
Wow.
Yeah, so that was cool data. And looking at kind of quadrupeds, not quadrupeds, tripods generally. So not just in our quadruped patients, so those with 4 limbs, but looking at those with 3. But like I say, we've also used it as there's many universities out there that use it as a tool to help look at their general studies that's looking for a treatment outcome measurement.
Yeah, I'm sure. And I mean, rehab centers is going to be, well, if they had one, you'd be using it all the time. And it's just, it's such a great tool for that. So when you get those figures, what do you normally do with them, and how do you advise people where do you go from there? Like, what would you do with those numbers?
Yeah, so it really depends on obviously what's the patient in there for in the first place. So if it's a case that it's an early detection patient, so we might be suspicious that maybe there's something going on, but we don't want to go for full diagnostics yet. We want to see what's what. And then obviously that will help highlight which limb A is the problem, but B, where that compensation is going as well. So we mustn't forget how important it is to identify the compensation, because 9 times out of 10, if we ignore that compensation, it's going to turn into a secondary problem, whether it's just through tightness because it's being overworked, whether it's through degeneration of the joint because, again, it's being overloaded. We need to protect any compensatory issues just as much as kind of any lameness. So we're then going to be able to decide, okay, right, is the percentage low enough that warrants further investigations or the start of whatever treatment option is for whatever condition. Particularly, obviously, for arthritis, we might say, okay, well, we're going to start them on laser therapy or medication or hydrotherapy. We're going to base that decision off what those figures are looking like. If it's more patient treatment monitoring, then it'd be a case of, again, depends on what treatment they've already been having. So if those figures are looking good and they're improving, then we're going to continue on the program that we already had in place. If maybe they're not looking so great, then we might say, okay, well, let's increase our laser sessions or dose, or increase our medication dose, or change what medication we're giving, or relook at weight loss again. Maybe the weight loss aspect, they've been struggling to lose weight. Let's kind of really try that a little bit harder to see if that helps. So it really depends on what the treatment program is for that patient and kind of how severe those figures are. But it just gives you, as a therapist or a vet or a nurse or whoever's kind of moving this patient on to their next stage, that confidence to say, it's not just me that thinks that they're improving or not improving, which I don't know about you guys, is massive, or was massive for me when I was in practice, because we all doubt ourselves occasionally. You kind of get that imposter syndrome where you're like, is it me? Am I seeing this? So
and I think as a client, you have the opposite. Well, not a client, as a dog owner, you have the opposite, where you really want it to be working, and so you see it is, and maybe it's not. but you really
absolutely.
wanted to.
Yes, absolutely. And that's definitely kind of there. I mean, I know for my own dog, he's had injections of his platelet-rich plasma this week in his joints, and I just want him to look better, and I want him
Yeah,
to look amazing. And I'm like, oh yes, I think there's already changes there, and it's like 2
yeah,
days later.
and it wouldn't have been.
So I know, like in my head, I know realistically that there's not much change yet.
Yes.
But as an owner, I'm going, oh yeah, I think I can see it. So I completely appreciate that side of things as well.
Yeah, yeah. No, it's from both sides, isn't it? I mean, I think from the slide that you've got up there, the changes in the percentages are in the contralateral front and back, aren't they? Which is
Yeah.
kind of what we expect. I suppose with that, it doesn't, well, without a clinical exam, that wouldn't necessarily tell us where the where the primary issue was, but it would definitely
No.
help you, like you said, look at compensatory mechanisms and see what's going on and what you need to be doing.
Yeah.
I wonder, does it differ at all if you do this on a dog that has been rested or exercised, or is there much
So
difference?
there, it again depends on what state that limb is in. If there was some, let's say, some arthritic changes there, and exercise classically exacerbates it, then yes, that will impact that figure because
Mm,
they're going to be more sore following that exercise. If that limb, those joints were perfectly healthy, providing that they haven't really worked so hard that they've fatigued themselves, there shouldn't be a noticeable, can't talk this evening,
mm,
difference in those figures. It, when we obviously use the stance, though, we are sensible in obviously recommending owners, we don't want them going for any drastic walks, exercise before they come in for a
yeah.
reading, because obviously that dog could go running, catch its leg in a hole, rabbit hole, darts off after a rabbit and twist something, and then obviously that's not going to be giving you a true value of the
Mm,
condition you were looking at anyway. So we wouldn't want an owner going on a big long walk or doing any kind of really energetic exercise before they had a reading. But equally, I've worked with some therapists that have purposely used the stance to assess that exercise. So hydrotherapy, for example, we can assess before they go into the pool or the treadmill what their values are, and then assess them when they come out
mhm.
and see how well they've fatigued. Actually, because again, it's very difficult to assess to a certain point how much is too much for some dogs.
Yes,
They
yeah,
absolutely love swimming, they'll just keep
yeah,
going.
of
Um,
course.
so if you've got something that can say to you, okay, well, last week when we kind of brought them off and we put them on the stance, we could see that it was too much. So
Mm,
next time we're going to bring it down a little bit.
yeah. And when they come in, this is quite a quick job, I guess, isn't it? And you could fit this in with just a normal appointment time, and if it's all set up in advance. I mean, how long does it take for the figures to come out? It's instant, I guess.
Yeah, so the figures are literally instant. So as soon as you've taken those readings in a nanosecond, the calculations have all already been done within the system. It's identified any anomalies in the data just to make sure that it's happy with the data pool. So if that dog moved when you were taking the data, it will identify that it doesn't like the readings.
Mm,
So as long as that's all fine, then you'll have that data instantly. I will say that when you first start using the stance, there is a little bit of practice involved with positioning of yourself, of the dog, getting used to
yeah.
where the remote's aiming to. So when you first start using it, there's a little bit of practice, but once you're kind of confident and comfortable with it, then generally very easily within a couple of minutes. It just depends on the dog's nature in terms of if they're particularly nervous. I'll often spend a bit longer just desensitizing them to the platform, but
Mm.
it changes with every dog. But generally within 5 minutes, you'll have that reading.
So when they stand on it, how does it feel for them? Is there sort of give in the surface? Is it make a noise or anything that might freak them out?
Yeah, so it's a bit of a squidgy. So it's relatively rigid, kind of a little bit like a weighing scales, but it just has a very thin foam layer on top. So it's a little bit squidgier than kind of a normal scales, but has roughly the same feel. So generally, they're not too worried about the feel of that. There is a beep. So when you take the readings, there is a beep. Now, you can turn that off, so you don't have to have the beep. But we added it in because what we were finding people were doing is, before with the old version where they had to kind of keep clicking, the user would be looking at the laptop to make sure that their readings were taking, and the dog had walked off somewhere else.
Yeah.
So we added the beep in so that the person doing the reading can just focus solely on that dog, not worry about what's going on the laptop, because as soon as they've heard that beep, they know they've captured the reading. But what happens is you press the button, it takes the data, and then it beeps very quickly within a nanosecond. But the theory is that before the dog hears that beep, they should have caught the data.
Yeah, because you can't even really have them on a lead, can you? Because you'll be influencing how they're standing.
Yeah, we want hands off this dog. Again, this is where we train people how to handle them on the stance analyzer, and train kind of different handling techniques and calming techniques to get the dog's focus on you. That's why we say you sit down in front of them at their level, so that they're not kind of pulling off or turning around and looking elsewhere. They're looking straight ahead. You're using whatever you need to keep their focus. It might just be your voice and just a command. It might be a treat. It might be Primula cheese, whatever it is that's keeping their focus. But you need to be hands off the dog when you're taking that measurement.
Yeah, because I know, like, when you're trying to weigh a dog in practice, the figures are kind of bouncing the whole time because they just can't stop moving. And I know this is done super quick, but that would be my I think if I was using it for the first time, that would be one of my concerns was, I don't know if they've moved, if I completely mucked it up, and but that doesn't tend to happen.
No, because you're treating it. I completely agree with what you're thinking, the way you're thinking that, every time my dogs get on the stance, they're a bit fidgety. But what we're asking them to do is a little bit different, in that we're often asking them to sit, they're anxious about their surroundings, and we're kind of not really paying attention to them and looking at that scale. Whereas when we're taking a stance, it's different in that we're not asking them to sit, we're getting them to stand. We're down at their level and we're getting their focus on us. So they're not too worried, and they don't tend to be as fidgety because our whole focus is on them, and we're often talking to them calmly, just sort of giving them those signals that we just want them to stand still, and then capturing that data.
And it's quite nice because you can have their owner in there. It's not like a treatment where, again, like an x-ray, where, well, they'd be anaesthetized for an x-ray anyway, but nobody could really be with them, could they? So this is completely normal. It's that anything can be in there. It's not like a sterile procedure or anything like that, which is really nice.
Yeah, absolutely. And I will kind of just say, hand on heart, in all the years that I've used it, I have had the easiest ones when the owners haven't been involved.
Have you? Okay.
And that's obviously because there's another person in the room. It's where they're standing, so you have to make sure they're standing directly behind you, and it's just an extra distraction.
Yes.
I do find it's easier without, but equally, if I've got a dog that maybe is very nervous and can't bear to be away from mum or dad, then absolutely I can kind of talk them through how I want them positioned to kind of keep their focus straight ahead whilst I take the data.
And can you use it? Do physios ever use it while they're doing the physio to see if any of the things they're asking the dog to do changes what's happening?
Yeah, absolutely. I've worked with a few physios over the year where we've really played with what else we can use the stance for, and things like asking a dog to perform a static exercise, but having them doing it on the platform, because when the platform's connected, you do get a live feed. So as the dog is kind of moving and kind of shifting their weight, these percentages that you're kind of seeing color coded on the screen here, when it's the live feed, they chop and change with how the dog's moving, so you can monitor exactly what's going on. So if I asked a dog to, say, do a sit to stand, it's really cool because you can see how are they standing? Like, are they
Yeah.
pushing up with the back legs, and that's where
Yeah.
most of the weight goes, or actually are they pulling forward with the front legs?
Yes.
It does take a little bit more work in terms of you need someone to instruct the dog and someone to kind of record or watch the screen so you can really concentrate on the live feed, but
Mm.
it's still an extra way. And another kind of really useful way I've used it is actually teaching my owners to do certain exercises. So, for example, there's the weight shifting exercise where you get a dog to stand perfectly squared up and you
Mm-hmm.
gently kind of rock them
Yep.
onto different limbs depending on what you're trying to achieve. And again, when I started thinking about this, I was like, well, how much movement is enough?
Yeah.
Like, if I'm trying to increase muscle tone or muscle like weight bearing, how much do I actually need to shift to get to
Yes.
what would be deemed a normal percentage? So I started teaching my owners to do weight shifting on the Stance platform, because then they can see in real terms how
Mm.
much they actually need to pull or kind of push gently over to
Yeah.
actually get to the right percentage.
Yeah, that's really useful, because I think, because I talk about some of those things sometimes with owners, about little things you can do every day,
Yeah,
just, little exercises just to help balance, coordination, that kind of thing. Um, but you're just talking about it, and when you show, it kind of depends on the size of the dog, of course, and the size of the person as to the amount of pressure you'll be applying. But
yeah,
actually, if you can see and feel while you're doing it, that's amazing. It really gets it, because I think sometimes you don't need a lot of pressure, and people think,
no,
I'm not really doing anything doing this. It's not, I'll
yeah.
stop doing it. I don't feel like it's helping.
Well, this
But
is it,
it is.
and especially in like very hairy patients, where sometimes you'll be taught to obviously look down alongside the muscle to see if you can kind of see obviously the muscle twitch as you're kind
Mm.
of rocking them. But if you've got a very furry patient, you can't see a lot, um,
No.
and it really got me questioning all the years that I taught the exercise. How effective had I actually been in teaching an owner? Because had I been teaching them to pull back enough? Uh,
Yes.
it really got me questioning.
And how did you, what was your outcome with that? Did you feel like, maybe I was getting to push them too much, or it wasn't enough? What did you feel?
I think I learned more so is kind of really kind of changing based on the size of patient. And that
Yeah.
sounds really obvious and simple, but I think kind of it's very easy when you're doing a movement very regularly. You kind of, it's like muscle memory, isn't it? You kind of have a certain movement and you just kind
Yeah.
of go with it. And it really made me really aware, particularly on those small dogs, um, how quickly they do fatigue, but how much I possibly either wasn't doing enough, like I
Mm-hmm.
was under kind of pulling, if you like, or over pulling. I'd say I was more likely to under
Mm-hmm.
pull back than I was to over, because I think I was being even more cautious
Yeah.
due to the size
Which
of the
is,
patient.
it's probably the better way, but oh
Yeah,
yeah. Yeah.
but still,
Yes. Yeah. I mean, that's, I don't know how many people would use it in that way, but yeah, when the ones that are sold, are they mainly to rehab centres, or a lot of veterinary practices getting hold of these now?
yeah, I think traditionally it was very much seen as a rehab tool, because we don't, as therapists, have many ways that we can objectively measure our
Mm.
patients. And we're obviously in a world where we're constantly needing to justify treatment direction. And obviously,
Yes.
there's absolutely reasons for that. But as therapists, we don't have very much that can guide us. So traditionally, it was seen mostly kind of in rehab facilities, but I would easily say over the last sort of 3-4 years, we've seen a real uptake in general veterinary practice, and that's for a range of reasons. In that more, say, senior clinics are being set
Mm.
up, mobility clinics, obviously OA clinics where
Yeah.
it works nicely, but also from I'd say surgeons are kind of very much kind of looking into this technology now, because again, it's justifying that their surgery has gone well. It's
Mm.
monitoring that progress for that surgery. Um, and I think we're moving away from this mindset around surgery that it's a case of cut,
Yes.
fix, and off you
Go
go.
home. Yeah.
I
Absolutely.
think it's now actually we're a lot more aware that there's a next stage to the
Yes.
process. for that kind of muscle building.
Yeah.
So it's really helping guide them a lot more as well.
Yeah, it used to be like, for example, probably the biggest thing that happens is cruciate injuries in any dog, but mostly large dogs, and they would have their surgery, and then they'd come back 6 weeks later. Well, they'd come back for the stitches out, and then they'd come back 6 weeks later and go, yeah, it's all fine, done.
Yeah.
And actually, that although they walked okay, if you'd had something like this, you would realize even though they seem sound, even you can feel the muscle wastage because they haven't really used it very well for a period of time. But it makes complete sense. If you're spending all this money and time putting your dog through a surgery, you don't just stop at that point, do you? And why we carried on like that for so long, and we just didn't have the tools, but it makes complete sense.
Yeah, and I've seen so many cases over the years that when they've come in, they've got barely any muscle on maybe one or both of their back legs, and
Yeah.
they had the surgery 6 years before.
Yes.
But again, there was never any kind of follow-up on that muscle
No.
building, and they're now suffering because of that. And it's a much harder job to bring that muscle back than what we could have done at the time. So definitely made changes there.
Yeah, because it's so important to do those things at the time, because they will, like you said before, dogs are on 4 legs, so they can compensate quite easily without you really noticing. So as soon as they're sound enough, they're happy to go and chase the ball or do a run again.
Yeah.
And it is only like 6 years later that you realise now their elbows are crippled because they've just been doing so much, taking so much of their weight and movement on the front legs, and we didn't need to be like that. And so but at the time you don't know and you don't realize.
Well, that's it.
Hard.
And then there's also the other side of particularly cruciate surgery, where we all know that when one stifle is gone, there's a very high percentage that other one is going to go at some point.
Yeah.
But how cool is it that we actually have something that can help us monitor that even closer, rather than going, oh, well, it looks like it might be struggling a little bit. Well, here we have a stance. We can monitor that limb as well as the one that's gone, the one that's had surgery. We can say, okay, well, it's looking okay at the moment. We're doing well, or we need to change up our program or our treatment to make sure and protect that leg that it's got as good a chance as possible.
Yeah, absolutely. I just want to answer. So, first of all, Barbara's just commented here, I would totally love to try this in my canine osteopathy practice in Germany, I believe, Barbara. I think you said earlier you're from Germany, before and after therapy. I'm sure they are available in Germany. Would I be right in saying that?
We have a lovely representative in Germany. I'd be more than happy to kind of hook you up with her. Saskia is lovely. So, she'd definitely be able to help.
So if you're interested, Barbara, please do get in contact. I mean, we'll put your contact details on the live as well there. And Janine has written here, do you use ACE-free work during sessions to observe behaviour, or is it all on a machine? So I think, do you mean like as they're walking around a room, choosing where they want to be, as ACE-free work is? I mean, this is a static thing, isn't it? It's not being able to use as they're wandering around.
Yeah, so you wouldn't be able to say walk the dog across it and take the same measurements. If they kept moving, they'd need to stop. But what I would say is, one thing we do recommend when deciding which direction to place the platform, because it is portable, so you can move it around your treatment room. So I always say, when a dog first comes in and they're just having a sniff around the room while you're chatting with the owner, is pay attention to which direction that dog wants to face, and then position the mat to face that direction. 9 times out of 10, it's the door that they came in, because they're obviously looking for their exit. But if there's a particular corner that dog seems fixed on, move the mat to face that direction. It's easier to move the mat to the dog than the dog to the mat.
Yeah, and although it has to be, is it connected to the laptop, or is it like a Wi-Fi? What do you call that? Wireless.
Wireless. Yeah, no, it is all connected. Just because of how quickly we want the signals to go through.
Yeah, you'd have to have super amazing internet. Maria's written there, would the stance analyzer be beneficial prior to a course on the underwater treadmill, attending physio regularly and pain specialists, lots of OA, elbow, hip dysplasia and disc problem? Oh, bless you, lots of things. Very weak on the hind limbs.
Absolutely. Yeah, because then you really get a grasp of how comfortable they are before going into the session, and gives you a better understanding of how much to do with them during that treatment, but also how well they're doing generally, and equally with all the other treatment that patient's having. Just kind of getting a better idea of how much help is the osteopathy, or whatever other treatment that patient's having, and how much benefit are they getting from it.
Yeah, that would be great, wouldn't it? Just do like the underwater treadmill, see what it's happened, to see, do a bit of physio, for example, or do a little bit of active physio type things, and see what would suit them best, because it is difficult sometimes to tell. I think whenever you have any kind of treatment, it is really tiring for the dog, because
Yeah,
they're doing a lot of thinking as well as acting, aren't they?
yeah,
Physically
absolutely.
and mentally. Um, just as a little side, can people stand on this and see what happens when they stand on it?
So I have spent many a conference competing with people on getting a good stance. And actually, ironically, when I've had students in the past, I've challenged them to get into a position that gets them 30, 30, 20, 20. And it's hilarious watching students trying to figure out how to
Yeah,
position themselves. But it's a great technique, because I'll let you into the secret that the tip is to do a downward dog. You
right.
can't get enough pressure on just your hands
Yes.
to get enough weight, which I think is really interesting on really showing how much weight really is going through their
Yeah.
front legs. So
Yeah.
that's kind of my giggle with students. But in terms of humans, the stance doesn't know what's standing on it. It just knows that there's 4 quadrants and
Right.
there's pressure going through. So technically, yes, but the problem we have as humans is when we know what we're doing, we're
Mm.
very good at manipulating. So
Yes.
for it to work for a human, you've really got to be distracted.
Yeah.
So I have an issue with my left knee.
Yeah.
And if I just stand on it, talking to someone else about whatever, and someone was looking at the data, they would see how lame I am on my left.
Yes. Yeah.
Um, if I stand on it purposefully, I can falsify the results to put 50-50. But I'm
Right.
aware of what I'm doing. A dog's
Yes.
not.
A dog is,
Dog
and that's
has
the
to be.
beauty of it, isn't it? It is a
Yeah.
true, yeah, yeah, that's really good. Janice has written there, thank you for the answer. Is this just for arthritis? Is there anything for dogs with spinal issues, spinal bleeding, ongoing issues around it? Is there anything available for this kind of thing? I mean, certainly with spinal issues,
Yeah,
it is going to affect the way your dog weight
absolutely.
bears. So
Yeah,
yes,
absolutely.
definitely
Any
worth using.
musculoskeletal, it could be soft tissue, it could be neurological, it could be OA, it could be joint, anything that would cause pain, weakness, lameness, then the stance will be able to pick it up. It obviously won't tell you, is it soft tissue or is it joint or is it
No,
neurological, but it
no.
will pinpoint that this area is a problem. And just with spinal, depending on where in the spine the problem is, it will affect those relevant limbs connected.
Yeah, definitely. And I think it's never going to be used as a tool on its own. It's
No,
always going to be in
yeah,
conjunction with what your physiotherapist or your vet or you as an owner are feeling in your own dog.
yeah,
And also,
absolutely.
watching how they move, watching how they sit, all the things that we always talk about.
Yeah,
It's just an extra tool to use to back up, and kind of for you, and like you're saying, you're that imposter syndrome, or I don't think I'm doing anything, or I don't know what I'm doing. It's showing you that actually you do, and really helpful. And also as an owner, just sometimes, because they're so good, because they're on those 4 legs, and they will, if they've got a little problem, or even quite a big problem sometimes
yeah,
with one of their back legs in particular, they'll just hop, they'll bounce, and they look like they're still having a great time. You don't notice anything. And
yeah.
sometimes it's just that little, this thing that will just convince people that, yeah, there's something going on.
Absolutely. And I've had many consults in the past where the dogs come into my consult room for one condition, and I automatically can see there's something else going wrong.
Yes.
And as soon as I put them on the stance, it's like, I'm really sorry you're going back to the vet, because that's not
Yeah.
the only issue going on here. So it's kind of showing exactly what is going on. You can't falsify the
No.
results in terms of the reading is what the reading is, whereas we obviously have our own kind of mindsets of what we think a condition might be. So
Yes.
it's going to support what is actually happening. And we kind of phrase it as the communication for the dog, because they can't tell us really what's wrong, but it's one way that they can tell us as best as possible what's going on. So yeah.
Yeah. I mean, do you ever do things like if they're on there? Because, you know, it's like when I'm in a consultation, I don't always, if I've got a very sore dog, I'm not kind of trying to stretch their legs a lot because it's not, you know, they're not going to like me for doing that. But what I do quite like to do is lift up a foot and just see how they shift their weight, or if they don't want me to lift it up. So that would be another way to use that, wouldn't it? If you picked up a foot, just to see then, do they then shift onto the other front leg, or do they just push loads more back because they really don't want to use that front leg?
Yeah, absolutely. And like people often say to me in the past when looking at, well, okay, if the dog doesn't walk on it perfectly square or in a perfect manner, how do you get them into position? And you can lift the limbs to help encourage them into position, because what you'll find is if the dog's sore somewhere, they're going to kind of just go back straight into the position that's comfortable for them. So yes, you might lift and gently allow them to replace it just to encourage them maybe a little bit further onto the mat, but that dog's going to return to the position that's comfortable for them. And interestingly as well, when, like you say, when you're trying to lift maybe a limb to see how well they can balance on the others, you can see kind of where is that pressure going? Are they kind of pushing it over to the front legs or back legs? And you mentioned earlier about obviously typically compensation kind of going diagonally through the body. So say hind limb is your issue and it goes on to the forelimb. It amazed me actually, because again, that's very commonly taught. But it's very common in dogs with singular problems. But most of the dogs that we rehab, in particularly, have multiple things going on. And they are such puzzles, because it's like the chicken and the egg. Well, what
Which
was your
came first?
primary?
Absolutely. Yeah.
And you just kind of see kind of the dog kind of shifting from limb to limb, and it really helps just hone in on, okay, well, where really is the problem and where is the compensation? And that might change from week to week based on, you'll probably be focusing on that limb a little bit more in your treatment, which means that it then eases up on that leg and is more effective on the other leg. So it makes those complex multiple lamenesses a lot easier to treat, because you can follow the pattern a lot easier.
Yeah, and I think it would probably help as well with diagnostic things like x-rays to work out, you know, sometimes I see a dog and I think, if I x-ray you, we're going to be there for hours because I don't know really where to start and stop. I kind of want to x-ray every single joint of you. But if you had something like this, you could have a better idea of where to start at least, and maybe not have to do quite so much for the poor dog.
Well, that's it. Yeah, it's really kind of just helping hone in on, okay, where really is the problem here? Especially if you've got multiple things going on, where is the worst? And I've been asked in the past, how realistic is it to expect a dog to be 30, 30, 20, 20? Is that just figures that seem great, but actually no dog ever is? But absolutely, if you've got a fit and healthy dog with no issues, they should be 30, 30, 20, 20. So that very, very subtle shift will be picked up.
Yes. And would you say that's the same for some of the, how would you describe them? Well, bulldog breeds, I suppose. I was going to say more like barrel types. Do you find that there's much of a difference with them?
Yeah, so no, interestingly, they still have kind of the same expectation for weight. And it's really interesting because I think we naturally think that they look heavier in the front end. But actually, in real terms, they still have more muscle over their back end than other dogs in terms of muscle mass.
Right.
That still balances out
It's
to
proportional.
40. Now, there are two breeds in particular that we believe there may be a slight difference, but we haven't got any data out there at the moment to support. And we don't believe it will be a drastic change. But the likes of dachshunds and greyhounds, they do have a slightly different body composition in terms of the elongated spine and the power from the rear end for the greyhound, but more so the elongated spine for the dachshund. So there is potential thought there that they may be different, but we don't believe it's drastic in that they're 50-50 or something like that. It would maybe be a couple of degrees out.
And it should still be equal front each side, shouldn't it? Front, right and
Yeah,
left.
exactly. So it still should be, if you've got a perfectly fit, healthy dog, they should be even across all four.
Yeah. Did you say you had a little video?
Yeah, just of me popping Vinny. So this is Vinny. I apologise, the stance isn't in the perfect position, but just due to video space. But hopefully this gives you an idea of how quick it really can be. So hopefully you can see this playing. So you'll just see me nudge Vinny over just to make sure he is roughly where I want him.
It's not on at the moment. I'm just going to take it off and see if we can get it back on again. View. Oh, and I think maybe no, that's
Tell me
still
when
that
to press play.
It's still on that other slide.
What if I come out of it? Maybe it's me.
There we go. It's that simple. I've got up there now.
Okay, so that's it.
Okay,
so if I start playing, is that playing?
Not yet.
Oh, it might not come through then because it's playing my end. What if I what if I play it from here? Does that?
Yes, that's playing. There we go.
There we go. We'll do it like that.
Perfect. So using food to get him on there.
Yeah.
Oh, look at that. He's done it before.
Yeah. In all fairness to him, he has done it before. But this is the thing about it as well. The first time is the hardest one because it's so new. I'll just play it again. But once they've learned what you want, they get it for next time. So it gets easier. And you see how I come down to his level. So that helps keep his head neutral because he's looking directly at me as opposed to lifting his head up or down.
Yeah.
Now, he is obviously very used to being handled. But if I had a dog that wasn't so, I would just maybe be gently holding on to the collar until very last minute. I'd be talking kind of just quietly, silly things, keeping their focus on me, gently lifting my hands off. And when I'm in a position where my hands are off and they're stable, then clicking that button to take the reading. And you'll see there then on that screen in the middle section, those are all my 25 captures. That's averaged out at the top here, which he's looking really good in those back legs. This was a little while ago, but I think this was just after his last lot of stem cells and PRP, actually.
Right. Okay.
So he was doing really well. We've been struggling a little bit with his right fore. He's one of those characters that has a million things wrong with him. So
it's mainly the hip, or is it? What was his presenting? You said it was the back leg initially.
Yeah, so he has hip dysplasia. He's struggled with iliopsoas strain because of the hip dysplasia.
Right.
He's got lumbar spondylosis. He had medial shoulder syndrome in that right fore, which is why that right fore was a little bit questionable. He's had stifle degeneration, but that seems to have been okay since his first treatment with PRP and stem cells and that one. He now had, last year, he started having a funky elbow lameness, and there was some early stage OA there. He's literally just been back this week for his top up for the year. And actually his hips and his elbows have not degenerated on radiographs. Considering he started having treatment 6 years ago, they have not degenerated any further. But he now has early stage shoulder arthritis. So all the areas we've treated have maintained. It's just he seems to develop a new thing each time.
And imagine if he didn't have you as an owner, then he may not even be here, I suppose, by now. So
no, he was a challenging puppy, and I wasn't kind of rehab trained back then, and I couldn't work out why he was such a challenge. Like he just really struggled with anything. He's a very intelligent boy, but we really struggled. And when, like I said, I started playing with the stance and then realized there was an issue, the difference in him when we started treating him was incredible, and he turned into a completely different dog. And everybody who knows me, whoever comes to my CPD, he's often there with me being the demo dog, because he is so broken. He's a really good candidate for people to see what things look like.
I mean, and also that kind of supports a lot of the other lives that we do about behavior and pain in dogs. And, you know, I
Absolutely.
think a lot of pups now, especially because there was such a surge during COVID, maybe didn't have necessarily the best breeding. And I think it's definitely a larger number of behavior problems going on.
Mm-hmm.
And I think that's maybe partly to do with it. Well, almost definitely partly to do with it, not maybe, definitely. So yeah, it's really nice that you said that, actually, because it kind of supports all the things that we always talk about.
Yeah, and we've worked with quite a few behavioural clinics that specialise in behaviour with the stance as well, because as you say, it's so common that behaviour is linked to pain. So
Yes.
they have the stance analyzers incorporated to check exactly that. Well, okay, let's just first tick the box. Is it definitely not pain related before we go through the full workup for the behaviour?
Yeah. Yeah, and I know Fran is here, is watching tonight. It's one of my friends, and she's, obviously she had it where she took her dog for the physio and hydro, and I also know that she works for a charity called Dog Aid, where they use dogs to help people. And again, it would be super useful for that kind of thing, because if you're going to be helping people, you want to make sure that you have a very fit, sound dog in order to do it. So there you go, Fran. Maybe Dog Aid needs to grab hold on one of these as well.
Yeah, definitely. Any kind of working dogs as well. We've worked very heavily. There's a vet over in Portugal, Dr. Alves, and he works with a non-profit organisation with police kind of working dogs, and they've done a lot of amazing research based off these working dogs and using the stance as kind of a baseline objective measurement, and kind of really even a study that was looking at the effectiveness of non-steroidal versus laser therapy in a treatment for dogs with hip dysplasia, and the results have been incredible. So yeah, definitely any kind of working dogs, keeping them in tip-top shape. I've worked with many working dogs over the years. Also, the other side of things, obviously we talk mostly kind of OA here, but the sporting side of things, I've worked with dogs that have competed for Team GB, and we've used the stance to make sure they're in tip-top shape and that there's no little niggles coming in. So there's so many uses for the stance. It's kind of endless.
Zoe's written here about, wow, imagine how many show dogs could be helped early on if they have one of these in the show ring. So not working dog. Well, it kind of is a job in a way, isn't it? But show dogs, yeah, I don't know. Again, it's a little bit of can be a hot topic as to how fit some of these dogs are when they're in the show ring. But absolutely, Zoe, imagine if you had one of those that you had to step on before you even went into the show ring. That would be amazing.
It would be interesting how many dogs would make it through.
Yes. Yeah, absolutely. And then this is quite a nice one to finish on from Janine. Oh, he was meant to be with you to live his best life for your dog.
Thank you. Bless him. I'll tell him that he's currently upside down over there in his bed. So I think he's quite happy with life right now.
Yeah, which is good. Not all thanks, but partly thanks to the stance analyzer. So I'm going to bring it to a little bit of an end here, because we're just hitting around the hour mark, and I know obviously you've still got work to do. But thank you so much for joining us. If anyone does have any other questions, please drop them down, and I can always ask Emily, and I'll put the link to Companion Animal Health as well.
I was going to say, I put my email on there as well. So if anyone does have any questions, feel free to reach out.
Lovely. Thank you. There is also, if you go on the website, there's a video about it as well, isn't there? It's very American, but it's there
is one that I've recorded as well, so there is an English version.
There's a webinar on there, I think, actually, isn't there, on the website as well? Yeah. So if anyone does have any other questions or interested, or go and talk to your physios or your hydrotherapists about it, and your vets, if anyone wants to come into my vets and persuade them to buy one for me, please do. If it will be used, I'm sure we could get one. But thank you everyone for watching, and thank you so much, Emily. We'll see, because obviously Companion Animal Health also do lots of other things that are useful for arthritis, so we can maybe have another chat about something else another time.
Yeah, no, thank you so much for inviting me on.
Thank you. See you all soon.
Bye.